If you're a diabetic getting ready to go on Medicare and you wonder how your supplies are covered, we got to back all the way up. So, if you're a diabetic, you have your supplies over here, which would be your test strips, lancets, sometimes continuous glucose monitors. And then you have your medications over here, your oral pills or your insulin. So, these are covered under two different parts of Medicare. So you know Medicare A, B, C, D. If you don't, if you're that new to Medicare, you need to go back, watch my Medicare workshop. It is free. You can watch it at any time. You don't have to register. Go to our website, themedicarefamily.com. The top of the page is a little tab that says resources. Click on that. That's how you get to my workshop. That'll give you the foundation of Medicare and explain A, B, C, D. And then come back and watch the rest of this video. So for those of you that understand Medicare Part B covers your test strips, your lancets over here, Medicare Part B. Part D, your drug plan, covers your insulin, your oral medications. Part B is where you get your diabetic supplies. Now they are covered under durable medical equipment. So if you want to look at your policy, if you want to look up on Medicare.gov exactly what it covers, how much it's covered, and how much you will have to pay, you can get the Medicare.gov app. Look it up. If you have a Medicare supplement, this year you'll pay your monthly premium. In 2025, your annual deductible is $257. So Medicare pays 80% of the cost of your test strips under Part B. You pay the other 20% until you've met your deductible for the year. And you're like, I've already met my deductible. I already went to the doctor right away in January. So your deductible, $257 for 2025. It does go up about $10 a month every year. So if you're watching this past 2025, it's going to be a little higher. I've already met my deductible, so my test strips are now free. I can't just go get it from Amazon. I can't get it from Amazon and send a receipt to my insurance company or the government. It doesn't work that way. You have to work with the durable medical equipment provider for your region. So you will work with your insurance company on that, and you might be able to go to this pharmacy and you might not be able to go to this pharmacy. So make sure you work with the approved durable medical equipment provider, and they can change. So if I've met my deductible on my plan, I don't pay for my supplies over here. How about if I only have Medicare A and B? I don't have a supplement. Then Medicare Part B will pay for 80% of your test strips. You will pay for the other 20%. How about if you're over here and you have private Medicare Advantage, Part C, an HMO, a PPO, different names, but they're all under private Medicare Advantage. Now you got to go to your policy because there's thousands of different types of policies. It might vary from county to county surrounding you how much the same company would charge you for the same diabetic supplies. So look at your plan. Maybe your diabetic supplies are covered. Maybe you pay up to 20% for all of them. So it's going to be different depending on what type of insurance you have. Let's go to continuous glucose monitors. That's a very common question we get at the Medicare family is, how do I get my Libre Freestyle 3 paid for? Well, you might not be able to get it paid for by your insurance. It depends on which type of insurance you have and then which type of continuous glucose monitor they pay for. So they might not pay for the kind that your doctor prescribes. So that's the same over here when we're talking about drugs too. If they prescribe this insulin and people call us and they say, hey, I thought insulin was $35 by law, capped. Kind of, sort of. Some insulins are capped at $35. Not all insulins. So if you look at your drug list for your Part D drug plan and it says Humalog is $35, and you're like, okay. I assume Humulin, a competitor, would be the same price. No, it might not. It might be $300. But your doctor wants you on Humulin and not Humalog. Well, you can be on the one that costs more and you can pay that copay, or you can be on the one that your drug company has limited at $35. So it's your choice. Not all insulins are at $35. So for people that their diabetes, their blood sugar levels fluctuate a lot during the day, many people are interested in a continuous glucose monitor. You have to get a prescription from your doctor. But this is seen as much preferable than sticking yourself constantly all day long, because you basically stick yourself once and then you can watch your blood sugar all day long. continuous glucose monitors were not easily accepted by Medicare. So that took some while, but now they do. They don't accept all brands, but they accept, I would say, a lot of brands. So not necessarily the one you want, but that has been expanding a lot in the last few years. So in order for Medicare to pay for a continuous glucose monitor, you have to have type 2 diabetes on insulin. You have already had an insulin pump, and your doctor can show that your blood sugar levels fluctuate a lot so that you have to test 4 or more times a day. So if you meet those requirements, yes, Medicare A and B would pay 80%. Or if you have a supplement, you've met your deductible, it would pay all of the cost. Or if you have Medicare Advantage, typically you're going to pay a copay depending on what insurance plan you have. Read your policy. Let's say you want a Dexcom sensor. Okay. What's your insurance? Let's say you don't have insurance. You have A and B, or you have a Medicare supplement and you haven't met your deductible, or you have a Medicare Advantage where you have a high copay. So can you use GoodRx? Can you use that handy little discount card that's available, the gold discount card that's available at most pharmacies in the nation? They've done the most amazing marketing. They're not necessarily the best discount card. There's a lot of other discount cards out there. I talk about them in my book, Medicare Mama's Guide to Medicare and Social Security. You can get it on Amazon. It can potentially save you a lot of money. But GoodRx is handy. Pull up the app, you can look at it, and you will see that they do have a discount when your doctor prescribes, in my example, the Dexcom one. And you could use that discount if you haven't met your deductible, if you only have A and B, or again, if you have copays, which you typically will on most Medicare Advantage plans. Remember that your insurance company will have a region, and you have to get your durable medical equipment, which these diabetic supplies are. There's other durable medical equipment, canes, walkers, beds, oxygen, other things that are durable, that can be reused, that are medical equipment, that are medically necessary. So you have to go through one of their approved pharmacies or one of their approved providers. So you can't just order it off Amazon. You can't just order it from just pick it up at some pharmacy that might not be in that network, or some provider that's not in that network. Now, there are people that do want to do that because they don't like that provider. They don't like the continuous glucose monitor that's available from their insurance company. They want this one that they have to pay for. It's the same with other types of durable medical equipment. I had people that say with catheters, they say, I was with this insurance company and I loved that catheter provider. Now I changed insurance companies. I like my insurance better, but their durable medical equipment provider is different. And I don't like their catheters. I want to go back to there. Well, you can't go back to there unless you change your insurance back there, or you're willing to pay for that out of pocket. So durable medical equipment, in this case, we're just talking about diabetic supplies, but it might leach into other areas of your life, has a network, and you have to stay in that network if you want to pay the lowest prices based on your insurance. You have more questions, which you will. Medicare is a long journey. Your health is changing, and the laws of Medicare, the insurance rules and regulations are always changing. So we have updated information on our website, the MedicareFamily.com. If you just want to book an appointment, you're tired of watching videos, you don't want to read anymore, you want to talk to a live human being about this, give us a call. Book a free consultation. Go to our website, the MedicareFamily.com. There's a little yellow button. Click on it. Book your own appointment. It's free to talk to us. Our services are free if you want us to help you enroll in insurance plans, and we'll be able to help you after you enroll for the rest of your life. Give us a call. And if you learned something today, please hit the follow, hit the subscribe button. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.